Let's talk about certain clinical features which are common to the primary myelofibrosis or the other types of myelofibrosis. Majority of the patients which present to us are asymptomatic patients. Or for example, they come for some other problem, and when you perform a regular blood screen, you can find out these abnormalities. So majority of the patients are asymptomatic. When the symptoms are present, they can be very common or like various common type of symptoms which are common to a lot of disorders like night sweats or fatigue or certain types of weight loss if it is present for a long period of time. So as you know that these are very non-specific symptoms that they can be attributed to a lot of diseases. So that does not help us much. The major symptom which is going to be present clinically is the enlargement of the spleen or the splenic enlargement. This is because of the extramedullary hematopoiesis. So whenever you have someone with, for example, anemia, documented on a clinical basis, and that patient presents with fatigue or certain types of night sweats, or if he is asymptomatic, but if he has a large spleen or a large liver and that is unexplained because of any other cause, then you should always consider the possibility of a myelofibrosis. What splenic enlargement causes that because of an increased size of spleen, the blood supply to it can be compromised, leading to splenic infarction, and this can be a medical emergency. It can also lead to certain other non-specific symptoms like fever. If the spleen is greatly enlarged, and it can cause certain types of pleuritic problems like the pleuritic chest pain. It can lead to the development of pleural effusions. And similarly, because of the rapid turnover of cells, because of the increased size of the spleen and increased hematopoiesis in the spleen, there is an increased purine production because of the rapid breakdown of the cells, and this can eventually lead to hyperuricemia, increase in the uric acid content. This can lead to gout and certain other problems as well. Secondary gout can develop, and as a matter of fact, the patients then they need to be on medication to control this hyperuricemia so that it does not lead to the other problems. Secondarily, because of an increase in the splenic size or because of that exuberant extramedullary hematopoiesis, the spleen or the liver enlargement can lead to other types of issues like in a long-term basis, there can be a development of the ascites because of the splenic enlargement. Similarly, certain types of hypertension like the portal hypertension or the pulmonary or the intracranial hypertensions, they can develop in these patients. Patients also present to us with intestinal or ureteral obstruction. This can be because of a mass effect of a large organ, a large liver or a large spleen. Pericardial tamponade can develop if the pulmonary system is affected. It can lead to increased back pressure. It can lead to pulmonary hypertension. It can lead to a pericardial tamponade development. These are rare presentations, but these can be found out in these patients, especially if the disease is very long term. Spinal cord compression can present because of the osteosclerosis. This can develop, and certain types of rare skin disorders like the skin nodules, they can also present to us. But the major clinical signs to look for in a patient with myelofibrosis are the development of the anemias, the blood cell count derangement, which we are going to see in the lab content, and clinically the patient will always have organomegaly, specifically spleen or the liver. The splenomegaly causes most of the symptoms in these patients, either due to its mass effect or size, or either due to its infarction or the exuberant extramedullary hematopoiesis, which can lead to hyperuricemia or secondary gout in these patients as well.